I actually founded the Melanoma Patient Network Europe after losing my husband to melanoma in 2012. So it was a very personal motivation to start that, because at the time there was no European network available for patients. So anyone like us who was confronted with the diagnosis of an advanced melanoma would go online, and we all met. Actually, the Europeans met on US forums because there was no such a thing in Europe. And then after losing my husband, I felt it was time that we had also something here, because our healthcare systems are very, very different. And in order to provide support, you need something that is local. And this is, how, I guess, how it all started. But now we have grown into something that we call actually a multi-dimensional network system. And I know that that's quite a mouthful, but what it basically is that there are country-specific groups that are groups with specific interests. For example, rare melanomas, regional groups, melanoma in Central and Eastern Europe. There are places for the Nordic countries, so melanoma in the Nordic countries. And what we do above all is connecting these different groups. And that has always been our ambition, to connect people and to share knowledge, but also good principles, and to pass on information. And because of my personal experience, but also by my background. So I have a medical background and a PhD in molecular biology. Our interest has always been very much, or it started with advanced melanoma. So we have always been very engaged on the research side. We are now partners in 2 Horizon 2020 projects. We review research proposals. We participate in research proposals. So we are very, that's, if you want, a science-based patient network. And of course, at the beginning, we attracted a lot of patients with advanced melanoma. And we provide, for example, training in how to read scientific literature. First, how do you find it? Then how do you access it? How do you read it? How do you have a scientific discussion? And this is how we became more and more involved in actually what is going on in melanoma in Europe.